Good morning, everybody. I think maybe we should start. Right. First, we have a keynote lecture, Global Health and Palliative Care, from Professor Liz Grant, who is Professor of Global Health and Development. She's the Director of Global Health Academy and Chair of the Scottish Government International Development Technical Advisory Group. It'll be great to hear from her. Thank you, Liz. The floor is yours.
Thank you so much. And it's wonderful to be here with all of you over these last few days. How powerful was yesterday and how powerful this morning to understand, to feel, to be part of a community that cares. You know, all societies, all nations, all peoples are very good at looking after their dead because there are traditions, there are rites, there are sacred rituals that allow us to look after our dead. And we hope within our health system and health sector that we look after those who are living. But somehow, as we've talked about yesterday and today, there's a gap for those who are living towards death and dying. What has happened? Why is there this gap in palliative care, this care of those who have life-limiting illnesses? What I want to talk about is this very thing and how globally palliative care has been missing from the global health agenda, but how organizations and interventions and communities like here in Nepal are placing it on the global health agenda. But first, this is important. We are born equal. And by that I mean we're born as a common humanity, brothers and sisters throughout the world. We are equal at heart. Our very souls are equal together, but we're born into very unequal circumstances. And as we know, we die in very unequal circumstances. And the key message is that we cannot change the inevitability of death, but we can change how people move towards death, and we can change how people live with illness. And we have a responsibility to do that. Now, you're probably thinking, why, in the context of living and dying, have I got a slide that's around crossing planetary boundaries? Because we've been thinking very much about crossing the boundaries of care. But I want to just ask you to think with me about where we are in the world today. And one of the real challenges is that we're in a world where there's where major crises are happening. We are crossing the very boundaries of the systems that hold the world together, the systems that hold us together. And by that I mean that these systems of water, the systems of air, the systems that allow our ecosystem to hold together. You see in 2009 where we were with crossing these boundaries, and it's work that Johan Rockström from Stockholm has done. You see where we were in 2023, how 9 boundaries assessed, 6 crossed. This is problematic, and I want to show why this is problematic, but why this relates to what we do in this very room today and what each of you do. Because our life journey is part of this global journey. And there's a triple crisis going on. We have a triple planetary crisis. You only have to look outside and you know that. We've got biodiversity loss, and we know Nepal has faced an enormous biodiversity loss, and it's impacting local farmers. It's impacting the very structure of the soil. We have pollution, air pollution, water pollution, contamination, pollution from plastics. Climate change altogether is shifting, hotter days, crisis in the way that we are experiencing our weather. But alongside that planetary crisis, we have a health crisis that's also a triple crisis across the world. We have a health crisis with increasing health emergencies that have actually been pushed by the problems of climate change and pollution and biodiversity loss. A health crisis with declining health metrics right across the globe. So you look at where Nepal is with our health metrics, recognize that, recognize where our countries are round about us, recognize that right across the globe, our health indicators are not actually getting better, they're getting worse. And a major crisis around inequitable access to healthcare. Something we all long for, something that is at the heart of this conference, leaving no one behind. And all of this is captured also in a triple societal crisis, a crisis where the cost of living, not just in Nepal, but the cost of living everywhere is going up and up and up, creating inequalities. We don't have to mention the word conflict because conflict is on the news every single day. We're living in a world at war, and a world that is actually in a very dangerous place. There's the big conflicts we hear in the television, or we hear in the radio, we hear in social media. And then there's the conflicts we've forgotten about, the conflicts in many countries that are happening with displaced people, with refugees, no one is listening or talking about. And then there is this societal crisis of trust. Trust is being destroyed. Mistrust, misinformation, creating multiple insecurities, cybersecurity, but information insecurity around what we even convey in health. And therefore, because of all of these, there is something that as we recognize this fractured world we're living in, there's something that we need to do. We mentioned this morning that health, and the ambassador talked about this, health is an extraordinary gift, it's an asset. But people who work in the health space bring something very unusual. They bring almost a form of diplomacy, a way of working together when everyone else may be at tension. Health is the foundation of the Sustainable Development Goals. Each goal depends on healthy people and a healthy planet. And each health allows each goal to flourish. So the challenge, though, is we are in a situation where we know that every one of our own countries, and here in Nepal, the country's national development plan depends on health. And it depends not just on the healthiness of people in Kathmandu, but it depends on the healthiness of everybody. It also depends, and this is what's so important, it depends on the healthiness of those who may be fragile, those who have illnesses, those who have in the past been left behind. The country's national development plan depends on everyone coming forward together. I want to just dwell a little bit on this planetary crisis and relate it to what the work that you're doing and the work of palliative care, this code red for humanity that Antonio Guterres talked about. And when he was here in 2023, he spoke, he described the situation of Nepal. He talked about how Asia itself, as a continent, remains the world's most disaster-hit region from weather and climate and water-related hazards. He talked about the floods and storms causing the highest number of reported casualties, the economic losses, the impacts of heat waves. But he said, humanity has a choice. What can we do? What do we do in this? This is a slide, maybe it's a slightly complicated slide, but what I was trying to show in this slide is how the events of the weather, how the events the climate crisis, the biodiversity loss, pollution, and societal crisis, how those events and those incidents and what happens, how those impact on our health. But I don't need to tell you that, because each of us see people with respiratory disease. You see people with illnesses that you can directly link to what has happened outside. We need to be thinking about this and thinking, do we, because we are aware, we have the data of what the weather, adverse weather events are doing. We have the data of what it's like to experience illness that has been driven by events. This data is important. This is a message we also need to give to government. This is a message that the world needs to hear, that the climate crisis impedes and impacts people's health, and that people are dying. And palliative care is essential in order to pick up early signs of illness, in order to keep managing and working. But as you can see, with water, with air quality, with food supply and safety, with vector-borne diseases. And already we have been mentioning and talking about the challenge of non-communicable disease, the global challenge of non-communicable diseases, accounting for 74% of global deaths. And yet, non-communicable diseases receives less than 2% of the big development aid funding coming from the bank, etc. Less than 2% for a set of illnesses, again, that the majority of palliative care services, the majority of palliative care workers are seeing on a day-to-day basis. And look at this rise in Nepal. This is quite a significant rise, with moving from the number of people, in 1990, 63% of deaths were related to communicable and maternal, neonatal, nutritional deaths. Now this has moved, and only at that stage 29% were non-communicable diseases. Now we're up to 63% in 2015, projecting up to 78% in a few years' time, in 15 years' time. That requires massive engagement. I mentioned the pollution. You only need to take pictures from outside. The air quality index gives us that message, that piece of data that we need to know where we're at with air quality index. This is worrying. This on the 12th of February, last week, this was the air quality index in Kathmandu. That's actually very dangerous. We are breathing in dangerous air, but we know, but this is dangerous for all of us who are healthy. It's exceptionally dangerous for those who have any illnesses at all. And we know COPD is the biggest killer here in this country, and pollution. But a point that we need to make is, it wasn't Nepal who influenced the world's air pollution. Nepal as a country hasn't driven the climate crisis, the biodiversity crisis, all the crises. Nepal as a nation is a recipient of something that a global community has done, and there is very inequitable access to the resources to respond. And yet, all of you can and are making a difference. This health crisis we're in, this health crisis is showing we have to do something. But inequity goes right across the board. There's an inequity in the resources that we have to deliver our health. We know that. This is a map of morphine available, and you can see the huge amount of available morphine for patients in Canada, USA, Australia. And we had already a mention this morning of how little, even though there's been work done around improving access and improving availability of morphine, how little in this area. So we are in this situation of interdependency and interconnection. We know that as a community, that we're interdependent and interconnected. But all of these challenges outside of us are interconnected and interdependent. We have, as Dave mentioned yesterday, a set of wicked problems that we're dealing with. And how do we begin to make sense? Why does it matter to palliative care? And how can palliative care become central? And it lies in this question of how do we make sense of the world around us? The real extraordinary gift of palliative care is that it brings people together. It cares for people with all illnesses. Palliative care is not just for cancer. Palliative care is for everyone who is living with a life-limiting illness, living suffering. So it brings together, it has that unique ability to draw teams together, because palliative care doesn't need just one person, it needs teams, and that's what that wonderful video this morning showed us, people coming together. Because in many ways, the quality signature of any nation is how it deals with those who are vulnerable, those coming into the world and those leaving the world, those being born and those moving towards death. If a nation gets that right, gets everything right, often we don't. There's no nation in the world that really gets this right. But we can learn together, we can share together, because this matters. And why does it matter? Let's look. You know, you've had palliative care describe the approach that it is. We know that palliative care, the WHO, and you'll be hearing from Megan shortly, and she is the WHO, the palliative care person in WHO, that palliative care has become an area that people are looking at right across the globe to say, something can be done here, this matters. It has a story to tell in this space. And part of that story is because palliative care lies at the very heart of universal health coverage. And universal health coverage is at the very heart of Nepal's health strategy. How can we ensure again that people receive care, but not care that that creates catastrophic cost? How can people receive the right level of care, the quality of care? How can people receive care right through? That investment in universal health coverage is an investment made by all governments, and palliative care is part of that. And without palliative care, we can't have universal health coverage because we do not have that coverage. One of the really striking things about the video was the message that there are people who are hidden outside, people who are not coming to the services, who are missing. Universal health coverage requires us to bring people in, for everyone to be part of that story. So there's this ethical imperative, the WHO imperative, because palliative care strengthens health systems. You all engaged in palliative care are actually strengthening a system. Because you're a part of it, you're identifying that your work, the work of caring for others, the work of caring for those who have been hidden, the work of caring for those with different diseases, is part of a health service, is necessary. A health system, a health service is far more than the hospital or the health clinic or the budget, even though those things are important. It's this holistic part. Palliative care provides that model of integrated care. And palliative care is an investment, not a cost. And we're hearing more about that this afternoon. People think, oh, we'll have to pay a bit more money and put a palliative care service together. No, for multiple reasons. But those big reasons are, A, dying is one of the most costly things that everyone does. So if there's no service and no care, people are using their own money, selling essential things that they need to live with, and in order to pay bills, in order to pay for treatment that might not even work. So good palliative care prevents that move to things that are not going to be essential, and it creates the right sort of treatment. But good palliative care also prevents intergenerational poverty. And all of you have seen this. Those who haven't received treatment then have gone to a hospital, have gone for surgery because someone said, well, if you just have surgery, this might work, in hope. But it wasn't going to work. The money has gone. The school fees for the children have gone, or the money for the food has gone in paying for costs. the next generation are out of school. Palliative care can be such an extraordinary investment to society. And that's a story we need to tell. So you have, and we have this reflected this morning as well, palliative care being about people, the patient, the family, you and I and the family and community together. Then there is this service infrastructure and architecture that puts around palliative care. So each of you is part of that architecture, bringing in, this is my piece of data, this is what I know, because this is what ministries need to know, bringing that together so that there is this global movement. And if you never doubt that you are part of a local movement, part of a national movement for palliative care, as we've heard, you're also part of a global movement for palliative care, saying that caring for people with life-limiting illnesses matters because people matter. So let's look just very quickly at a couple of other areas where palliative care is speaking into this crisis. This thing about recognizing the holistic nature of pain. Again, we've had that emphasized. There's physical pain, but there's psychological pain, spiritual pain. There's pain, social pain of exclusion. Palliative care is extraordinary because it brings all of that together. Now, that doesn't necessarily happen in other wards in the hospitals and other specialties, but bring your message to others because that is the heart of good quality care. It's inclusive. That's part of our mission, leaving nobody behind, valuing life and death, and valuing those who are living with illnesses of which there are no cure. Palliative care challenges the status quo, because when we know that there are those, and we saw in the videos this morning and in the snapshots seen in the first plenary, we saw what it's like to live in rejection, what it's like also to live with nothing. We saw too what it's like to live with someone else giving their all to help move forward. That is a gift, but that gift gives each of us something really important to share with others. That's why the work of EMS, the work of INF, the work of Sunita is so important, because it's saying we know something special. And palliative care respects the interdependency of lives, because we know that lives depend on nature. We know that so many people depend on the land for their living. We depend together. I've mentioned universal health coverage as that key component of Nepal's strategy, of a global strategy, and particularly after COVID, Dr. Tedros in WHO, the Director General, said, we have to invest in universal health coverage, and a way to invest is investing in primary healthcare, strengthening our primary healthcare. So very recently, this production came from WHO, in fact 2 weeks ago, compassion and primary healthcare. Compassion is what makes Sunita model extraordinary. Compassion is what has led the work to happen. Compassion is what allows the work to continue. And the one word to carry, well, 2 words, I want you to carry forward the word compassion and the word integration, because these two are fundamental for strengthening a health service, but they're also fundamental for bringing about change. So, as we think of of the material and all of the information we learned yesterday, and as we think of those extraordinary talks this morning, where is palliative care's place in the global story and the story of life that we're part of? I'll just suggest in 3 things. Our place is in time. We have immediate work to do, but there is something extraordinary about investing in the immediate in palliative care, recognizing, finding people, supporting those families who may not have had anything, because that leads to a next generation. That leads also to the care of those people, allows them to care for the land around them. Time, immediate and long-term investments. Palliative care speaks into the story of place. As I say, it's something about us here doing something, the work that's happened in Nepal, but it's something about carrying that story forward and realizing the global contribution. And importantly, it's about justice. I don't know whether you've thought of yourselves as people who are actively working in justice, but palliative care is about justice because it narrows inequalities. It increases the flourishing. It identifies those who have been left behind. It calls out wrong. It calls and it provides the data that allows governments, that should allow governments to make choices. So remember, if I can beg on you, remember that what you're doing, you bring that is data, it's rich, it's people's lives. People are data in the sense that people bring us the real truth, the story behind the numbers. And it is the interaction you have with people that changes everything. You saw how it changed this morning. That's your story to bring forward as well to the municipalities, the ministries at work. So compassion. I'm going to finish with a few thoughts on why compassion. But I want to just define compassion, because we use the word a lot. Compassion is about noticing pain and suffering, and then understanding where it's come from, and then feeling into it. We often think of compassion just about feeling concern, our heart and our head together, and it's about acting to alleviate the suffering. Compassion is these four things together. It's not just one of them. And this noticing pain and interpreting, I can't emphasize how much, because again, as palliative care practitioners, as people who support palliative care, you notice pain and you ask, why? Why? What's the cause of this pain? What's the cause of this pain? What has happened? Why is the inequalities, the inequity, the challenge has happened? What can we do about it? And it's why it matters, because compassion shines a light on what lies behind the Sustainable Development Goals. It acts as a driver to come and bring those Sustainable Development Goals, particularly the goal of health, forward. It creates the conditions to meet the goals. And it is the gift that each of you have. It's the gift at your work. So we started with a visual of a fractured world, of a triple planetary crisis, a world that needed something, and a world where palliative care sat. How do we get where we have knowledge? And every person, remember, each person we meet has some essence of knowledge. They have knowledge to how to look after the earth. Every person we care for will have an inkling, a piece of knowledge brought together. That wisdom can make things complete. We can think about the co-benefits of working together. We can think about the safe boundaries of working in teams that connect together to have planetary health, to have a balanced, compassionate world. We can think about how in our work as palliative care practitioners and organisations do we really demonstrate, model cohesion? Do we show societal cohesion? Do we invest in health? These are the opportunities with compassion in palliative care, the opportunities that pushes us to think about relational work. In the video we heard that message, that clear message, we need to listen to others, to listen to patients, to find those who are hidden, but to work together. Regeneration and restoration at the heart of palliative care. You might not have seen palliative care as a restoring, regenerative system, but it is, because it brings hope. And it brings hope to everyone until they move from this life to the next, until they pass those boundaries. And it helps us. Palliative care allows us to reimagine the change in our health system, the change in our world that is being influenced and shaped by these crises, and the change in patients' and families' lives. and the change in our lives, because the gift of palliative care and the gift of working in partnership has been learning through sharing, knowing that together we are working for a better world, working for a better place, and working to help each person. Thank you.
For that wonderful presentation, we can see your passion behind it and bring the global perspective. And perhaps palliative care can rescue humanity from the brink and bring all the people in the world together. Thank you so much for that wonderful presentation.